Welcome to another episode of Med Madness, your go-to podcast for mastering the intricacies of medical conditions. Today we delve into a critical and life-threatening condition that every medical student must be familiar with. Acute fatty liver of pregnancy, or AFLP. Understanding AFLP is essential due to its high maternal and fetal mortality rates and the urgent need for swift intervention. In this episode, we will explore what AFLP is, its symptoms, diagnostic methods, treatment options, and even walk through a real-world case study to illustrate its impact. Next, let's discuss what this condition is. Acute fatty liver of pregnancy is a rare but serious condition that typically manifests in the third trimester. It is particularly prevalent in pregnancies with multiple gestations. The underlying cause of AFLP is believed to be defective fatty acid metabolism between the mother and fetus, leading to the accumulation of fat within the liver. This metabolic dysfunction triggers hepatic inflammation and can rapidly progress to fulminant liver failure. Understanding the pathophysiology of AFLP is crucial as it highlights the importance of early recognition and management to prevent severe complications. Now, moving on to symptoms and clinical presentation. Patients with AFLP often present with a constellation of symptoms that can easily be mistaken for other conditions. Common symptoms include persistent nausea and vomiting, right upper quadrant or epigastric pain, and general malaise. As the disease advances, more severe manifestations such as jaundice marked by scleral icterus and profound hypoglycemia may appear. The condition can further deteriorate into multi-organ failure, evident through signs like disseminated intravascular coagulopathy, thrombocytopenia, and acute kidney injury. Diagnosing AFLP requires a high index of suspicion, especially in the third trimester of pregnancy. Clinical evaluation is paramount, supported by laboratory findings such as profound hypoglycemia, elevated aminotransferases, increased bilirubin, thrombocytopenia, and evidence of disseminated intravascular coagulopathy. Imaging techniques like ultrasound and MRI, though typically safe in pregnancy, are often unnecessary as the diagnosis is primarily clinical. Timely diagnosis hinges on recognizing the pattern of symptoms and lab abnormalities to differentiate AFLP from other hepatic conditions like preeclampsia and acute cholecystitis. Now, let's discuss the management and treatment of AFLP. The cornerstone of AFLP management is immediate delivery, regardless of gestational age, to stabilize both mother and fetus. This urgent intervention is critical due to the high mortality associated with delayed treatment. Medical management focuses on stabilizing the mother's condition, addressing hypoglycemia, correcting coagulopathies, and supporting liver function. Post-delivery, careful monitoring and supportive care in an intensive care setting are essential to manage any complications. Early diagnosis and prompt delivery are vital in improving outcomes for both mother and child. Let's look at a case study. Consider a 32-year-old woman in her third trimester presenting with persistent nausea, vomiting, and right upper quadrant pain, initially suspected to have preeclampsia due to her symptoms. Further evaluation revealed profound hypoglycemia and elevated liver enzymes. With these findings, AFLP was suspected. Immediate delivery was performed and subsequent treatment involved correcting her metabolic abnormalities and providing supportive care. This timely intervention resulted in a favorable outcome for both the mother and the newborn. In conclusion, acute fatty liver of pregnancy is a critical condition that demands immediate attention and intervention. Recognizing the symptoms and understanding the pathophysiology are essential for early diagnosis and management, significantly improving maternal and fetal outcomes. We encourage you to engage with our pre- and post-podcast quizzes and utilize the Anki flashcards to reinforce your understanding and retention of this vital topic. Thank you for joining us on Med Madness, and stay tuned for more insights into essential medical conditions.